Great. Okay, I think we're gonna go carry on and get started. So thank you so much for joining us here today. I know it's quite difficult to take time out of your busy days to spend an hour over lunch coming in and listening to us talk, but we're really grateful that you've all come to join us. What's the focus of today? Today we're going to be talking to you about Switch, talking to you about Accurx and giving you a first look at the Accurx app and Accurx Scribe. So lots of things to cover over the next 40 minutes or so. So let's get started. So who's going to be talking to you today? You've got myself, I'm Vish, doctor by background, but I'm part of the clinical team here at Accurx. Yeah, really excited to speak to you all today. And I'm joined by my colleague from our privacy team, Deanna, who's going to be talking a little bit about some of the security and privacy measures that we've introduced to the app. So great to meet you all. So just a little bit of housekeeping before we get started. So this webinar is being recorded and we'll share that recording with you afterwards, along with any resources that we do mention today. So don't worry about needing to scribble anything down as we go on. If you do have any questions during the session, please use the Q&A function. You can then type them in at any point and we'll hopefully be able to get around to your questions. If you see a question that you like, use the upvote button so we can prioritize the most relevant ones when we get to the Q&A section at the end. So in terms of the agenda today, there's a few things that we're going to cover. We're going to start with a look at how we've gone from Switch, as you know it, to Accurx, and what stayed the same and what's new. Then we're going to walk you through what's actually coming to Accurx imminently, including some exciting features we think will make a huge difference in your day-to-day use of the app. And after that, we're going to dive directly into Accurx Scribe, what it is, how it works, and we'll show you a live demo of how it works in practice as well. We're also going to take a few minutes to give you a quick overview of clinical safety and information governance information, specifically what you need to know around using Scribe and the Accurx app safely and compliantly, as well as some of the new security and privacy measures that we've included as part of the app as well. And finally, we're going to open things up for some Q&A. So keep your questions coming throughout using the chat and upvote any of those that you'd like us to prioritize with you today. So just to give you a little bit of a brief introduction about Accurx. So who are we? We're a health tech company that started back in 2016, originally focused on actually trying to help GPs manage their antibiotic prescribing. But we quickly realized that the real blocker in healthcare was communication between staff, between services and with patients. So we shifted our focus, and today Accurx is actually used across the NHS to make that communication much easier, whether it's messaging patients, whether it's doing video consultations, collecting structured data through questionnaires. Our goal is to really simplify how healthcare teams and patients work together. So we now support everything from GP practices to hospital trusts, helping those teams who work there save time and give patients a better experience. And what are the challenges that we're actually trying to solve here at Accurx? So to start, I just want to take a step back and talk about why we've gone on this journey, in particular with Switch. Because for me, it really comes back to some of the fundamental problems that we're all facing when we work in the NHS. So firstly, communication. As a doctor, I know and have felt how fragmented things can be, trying to get hold of the right person, getting a second opinion, referring to another team, and then actually making sure that the patient knows what's going on. A lot of the time, it's harder than it should be. And the amazing thing is Switch started tackling that head on by making it easier to reach your colleagues across your organization. And with Accurx, we're trying to build on that. We're trying to make that communication smoother, not just between individuals, but across teams, services, and patients themselves. Secondly, admin. We all know how much of our time is eaten up by documentation, whether that's typing up notes, whether that's chasing paperwork. It all really adds up. I know we're probably writing maybe 20 to 25 sets of notes per day on top of everything else that we're doing. And a third of our week roughly goes towards just administrative tasks. And often that means finishing late or catching up between patients. And it's a huge contributor to burnout. And it also pulls us away from what we're really there to do, which is to listen to patients, talk to them, examine them, and treat them. And thirdly, working across the system. In reality, when you really look at healthcare as a broad sphere, it's a communication industry. Good care relies on good information getting to the right person at the right time, whether that's a GP sending a clear referral into secondary care, whether it's a ward doctor chasing history from primary care, or even if it's just about updating the patient and their family. So when that communication process breaks down, care suffers. So much of what we're trying to build at Accurx is about making that flow of information between different people involved in a patient's care that much easier. So talking a little bit about Switch. So let's take a step back. So Accurx acquired Switch in 2023, and it wasn't just about expanding our product. It was solving a problem that many people who work here at the company have felt every day working in the NHS. As I mentioned, you know what it's like. You're trying to get hold of someone urgently. You need a quick answer. And Switch changed that by giving you that directory that allowed you to easily contact those people that you needed in that moment. So that's why when Accurx took it on, the aim was really, really clear. Keep everything that made Switch great, the speed, the simplicity, the directory, and the fact that it just fits into how we already work, and then take it a little bit further. We wanted to build something that doesn't help you find the right person, but also allows you to message them directly, loop in a team to send updates to a patient, or share notes or results with a patient, all from one place. Because actually the real value isn't in the tech itself, it's the time that it gives back to you. So as you can see here on the left-hand side, you can see that this is what Switch used to look like, and this is what Accurx is going to look like very, very soon. So the new Accurx app is really our way of delivering on the promise that we made when we first acquired Switch. That's giving each of you the tools to take back time in your day and make that communication easier. So I'm going to walk you through a few of the things that we focused on. Now, firstly, the directory that you know and that you rely on, that source of truth where you go to try and find that contact details to get in touch with the cardiology registrar on call or speak to critical care. That is still there. We know how important it is. So we've kept all the core functionality that you're used to and built on top of it rather than replacing it. Secondly, we're putting messaging into your pocket. So this was a big priority for us, making sure that you can message more easily on the go. It's one of our bread and butter tools that we've used in primary care, and a growing number of secondary care organizations are using it in the same way. And it's also secure and properly linked to your NHS and Accurx account. Then there's messaging GPs. So a lot of people know Accurx from what we've done in primary care, and we wanted to make sure that we were the people that could connect you better with primary care and really, really help that cross divide across primary and secondary care. So now, as a hospital clinician, you can use Message GP to contact GP practices directly. 98% of GP practices in England use Accurx. So with this tool, your message will land directly into their Accurx inbox, not buried in emails or stuck waiting on the phone. And on average, we're seeing replies in under an hour. And finally, a big, big part of this upgrade is security. You've probably seen the process of authenticating the app with your Accurx account. That's just the beginning. There's a whole new suite of security features that we're building in, which is absolutely critical to continued safe use of the app. And that's what Deanna's going to take you through a little bit later today. So now you might have noticed that I've skipped over the very top of the app. That's because I want to go a bit deeper into Scribe, which for me is one of the most exciting parts of what's to come. So introducing Accurx Scribe powered by Tandem. So Scribe is our ambient voice technology. It uses AI to listen to either a live consultation or a dictation, and then transcribes and summarizes that into a structured clinical note or document that's ready to review, ready to edit, ready to copy into your records and create any further onward documentation that you might need. Now, as a doctor, I know that how much time we spend typing up notes, often after hours, trying to remember exactly what was said. And with Scribe, the aim is simple. Let's try and take that burden away. Let's let you focus fully on the patient and get your time back. Now, you might have seen that we've said Accurx Scribe powered by Tandem, who's our partner on this venture of creating Accurx Scribe. And who are Tandem? They're a health tech startup based in Stockholm, Sweden, that specialize in AI-powered ambient scribe technology. But why did we choose to partner with Tandem specifically for Scribe? And we looked at a lot of options, but Tandem really, really stood out, not just because of the tech, but because they meet the incredibly high bar that we set at Accurx across the board. And also that 60% of the team that have built the tool are clinicians themselves, so they really understand the day-to-day of using tools like this in their clinical workflows. So their product privacy, security, and clinical safety standards were rock solid. All the patient data stays in Europe. None of the audio that's captured by the scribe is ever stored. They've also demonstrated consistently low hallucination and omission rates. So this is where the AI sometimes can make up, random bits and bobs that maybe wasn't quite said in the consultation. And this actually trying to validate that these rates were low was absolutely critical for us for clinical use. And the key thing is your data is never used to train those AI models. But beyond the tech, the team really impressed us. They care about trust, they care about patients, and about the responsibility that comes with working in healthcare. So what this partnership gives us is the ability to unlock the power of Scribe and messaging. We know that the NHS doesn't need any more standalone tools. We know what it's like. There's a lot of systems that don't talk to each other, platforms that feel bolted on rather than actually integrating in the way that we want it to work. So that's why we think ambient scribes and messaging has a real power to unlock lots of cool stuff down the road. So right now, Scribe can generate your structured editable notes from a live consultation or dictation. It's already being used in real NHS settings. But where it gets really exciting is what's going to come next. We're not just building it for Scribe alone. We're going to try and make sure that those notes can go directly back into the record. The follow-up actions that come from Scribe can be sent straight to the patient or the GP through Accurx. The Scribe summaries can maybe trigger some pathway workflows, booking follow-ups, ordering tests, sharing safety netting advice. The possibilities are endless when you combine the power of Scribe and messaging. And over time, we see Scribe becoming the entry point to a fully integrated, intelligent workflow. So how does it actually work? I've done a lot of talking about the plans, what we're doing, how things are changing, but how does it actually work when you're using it in the app? So you can launch it directly from the app itself, whether you're in a clinic, whether you're on a ward round, whether you're doing home visits, or even just dictating follow-up notes from your car after a long shift. It works in person, it works over the phone, wherever your consultation is happening. And once it's running, it captures your conversation in real time. So whether you're speaking to the patient or you're dictating afterwards, it uses AI to transcribe and structure it into a clinical note. So you don't need to go away and start typing in between patients or trying to catch up on documentation at the end of the day. And then we've also got a seamless handoff for you being able to access those notes on a workstation or a computer. So you can pick those up straight away and carry on editing and reviewing them before moving them into your notes. And from there, you can copy that into your record. You can share the output with patients and GPs right from within Accurx itself. So without further ado, we're going to go straight into a demo. Now, this is where getting the tech set up to get a mobile screen onto the computer can be a bit tricky at times. So I'm just going to get that set up really quickly, and we can get cracking with showing you the demo. Okay, just want to check that everyone can see the mobile screen. Great, fantastic. Awesome, wonderful. Nice to see all the thumbs up. Okay, right. So here we are. This is the Accurx app. Now, as you see that you can go in, there's probably a bit of a change when it comes to the skin of the app, slightly different color scheme, slightly different look. But just to reassure you, all the existing functionality that you had within the app will exist as it did before, with just a few bolt-ons on top of that will really help you change the way that you use this app moving forward. So I'm going to scroll up and down this app. You can see there's a variety of different options that you can go in and take. You can see here that hospital directory, that absolutely critical piece of critical tool they've been using on a day-to-day basis is still there. All you need to do is just click on hospital directory and you'll be able to find the contact details for those colleagues at your hospital or your trust. You can also switch between those trusts depending on where you work as well. You've also got a quick action button here right at the bottom that will take you straight into the directory as well. Now, if you go back on home, you can also see that there's a new button here called GP Directory. GP Directory is really exciting. You can click into that and you can actually find the contact details for any GP practice in the country to be able to communicate with them directly if you need to get in touch with them. So all you need to do is just search for the GP practice that you're trying to contact. So in this case, I want to contact the Accurx practice. That will come up. And you can just click straight into those contact details and get to them straight away. So you can see here, you can call that GP practice. The other really cool thing that you can do with Accurx now is if that GP practice is using Accurx, you can also message that GP directly, and that message will land in their Accurx inbox. So another really exciting feature there. So that's the GP directory. So talk through the hospital directory, we've talked through the GP directory. Now you can see at the top here, there's all new buttons here with new functionality for you to get used to. So the first thing I want to touch on is just message patient. Message patient is the ability for you to find a patient in the NHS and send them a message, whether that's sending them a leaflet, whether it's sending them test results, whatever it might be, really being able to do that on the go directly from your phone. So you click on message patient here. All you need to do is search for that patient's NHS number. So in this case, I'm going to use Thomas. going to search for Thomas here. You can see that Thomas's number has already been populated there. That number is directly pulled from the personal demographic service of the NHS Spine. So you don't have to go fiddling around to try and find that patient's number. We'll pull it directly from PDS for you. And you can go in here and you can literally free text anything that you want to put into this message to send to that patient. Super flexible, super easy. The other thing that you can also do, you can see here that there's a button here at the bottom where you can actually attach a number of files that you want to send to the patient. Like I said, useful for leaflets. And you can also allow that patient to reply. So if you send a message to a patient and you want them to reply back to you, you can click on allow reply and that reply can come back to you as well. Now, this doesn't create an open channel of communication when you send messages to patients. You have to click that button to allow them to reply back to you once. And then you can click send here. So that message gets sent directly to Thomas. You can also schedule that message to be sent in the future as well. So that's messaging with patients. We've already talked through message GP briefly, but you've also got a button here to message the GP directly. You would just search for a patient whose GP that you want to contact, and that will take you straight into a screen where you can send a message to that patient's GP. Again, really simple, really easy to get through. And finally, if you do send a message and you're thinking, but if someone replies, where does that message actually go? That goes into your inbox. So if you click on the inbox here, that'll take you into my inbox where you'll see any conversations that you're having with patients and with other healthcare professionals coming back into your inbox here as well. So that's the inbox. So that's a really, really quick whistle-stop tour through some of the new features. But the thing that we're going to focus on in particular here is Scribe. So I'm going to click on Scribe, and you can see here there is a brand new button here at the top that says Start Scribe. And I'm going to go into that, and you can see that it lands on this page. It knows who I am. It knows that I'm ready to start a consultation with the patient. So if you want to get started with Scribe straight away, all you need to do is just click on Start, and that will start using the tool to listen to the conversation that you're having with the patient. But before we do that, there's a few things you need to be mindful of. You can see here at the bottom where it says Encounter Settings. You've got the ability to switch between carefully created, pre-made templates that we built alongside clinicians in the NHS to tailor it to the exact use case that you're using it for. So today, I'm going to have, Deanna is my patient, and we're actually in A&E, so we're going to be doing an A&E clerking. But if you click on the template, there's a whole list of templates depending on the specialty that you're in that you can use to create that note at the end of it. And you've also got to make sure that the microphone that you're using is the right microphone to use as well. Now, the other thing that you can do, if you look here on this side panel, you can see all the previous encounters that you've had, and you can also be able to access a user guide. The user guide will take you through how to use the product again. Now, what we're going to do now is just go away and click Start straight away. So I'm going to click Start, and I'm just going to start speaking into the Scribe. Now, one thing to bear in mind is that the Scribe is really, really good at blocking out that background context or non-important information that you might be discussing with the patient. Say it's the weather, say it's you're talking about the traffic. It'll listen to that, but it won't include that as part of the note, so it can strip that back. You also have the ability to pause at any time if you want the Scribe to stop listening in. But we're going to go away and get cracking straight away. So I've got Deanna with me, who's my patient for today. So we're going to do an incredibly heavily simulated patient encounter just to show you how that looks. So hi, Deanna. I'm Dr. Menon. Can I take your full name and date of birth, please? Thanks, Deanna. I understand you've come in with some chest pain. Can you tell me more about that?
Yes.
Okay, and did that pain, did it spread anywhere? Did it go to your arm? Did it go to your jaw?
Yeah, into my left shoulder.
Okay, and have you noticed any breathlessness or any nausea or any sweating? And have you had any similar episodes to this before?
No.
Okay, and do you have any medical conditions or medications that you take?
High pressure. I take Ramipril 5 milligrams, and cholesterol was high last year, but I'm not on anything on it.
Okay, have you got any allergies at all?
No.
And do you smoke or do you drink?
I quit smoking last year, and I drink maybe once a week.
Okay, and have you got any family history of heart problems?
My dad had in his 50s.
Okay, what I'm going to do now is I'm going to just check you over really quickly. So one thing about the Scribe is you've got to make sure that you vocalize your findings to the Scribe as well. That's how it can pick up that context. So your heart sounds regular, your lungs are clear, and there's no tenderness when I press on your chest. In terms of your vital signs, your blood pressure is 136/84, your heart rate is 78, your respiratory rate is 16, the oxygen saturations on air are 98%, your respiratory rate is 16, like I said, your temperature is 36.7 degrees. Okay, so far your physical exam and your observations are stable, which is really, really assuring. I've had a look at your heart tracing, what we call an ECG, and that also looks normal. So there's no signs of anything acute going on, which is fantastic. And we've already got your first blood test back. It's a blood test called troponin, and that's come back as 4, which is well within the normal range. So what we're going to do now, with the chest pain having settled, with all your initial tests looking good, we're not seeing any signs of a heart attack today, which is really, really reassuring. But with your blood pressure, your borderline cholesterol and family history, we do want your GP to follow this up in the community. So we're going to write to them, asking them to do a full assessment. And that might include a few blood tests for a lipid profile, a HbA1c to check for your risk of diabetes, and consideration of some other tests like a stress test or an exercise ECG. Does that make sense?
Yes.
Okay, and I'd like to keep an eye on you. I'd like you to keep an eye on these things if possible. If you get chest pain again, especially if it's prolonged or comes with shortness of breath, please do call 999. All right?
Thank you.
No problem. So I'm going to now pause the scribe. So that was a really, really just quick consultation, just the 2.5 minutes or so. Of course, the scribe is capable of being able to listen to far longer conversations than that. So just to show you the power of the tool, we're going to go away and create the note straight away. Now you can always see at the bottom, there's a discretionary statement at the bottom, something to always bear in mind when using AI, that these things can make mistakes. You've always got to review the output that comes out of it. So I'm going to create that note. And as you can see, it's just completing that transcription and it's creating that note in the background. So you can see here, you've got the reason for the presentation, the history of presenting complaint, that past medical history, the medication that they're on, the allergies, their social history, their family history, and their examination findings here as well, including all of those observations that we talked about and the blood tests. And if you scroll down to the bottom, you can then see that you can add or adjust this if you want to as well. So you can add or adjust it by just speaking into the microphone and making any changes. The other things that you can also do is create downstream documentation letters. If you wanted to create a letter for the patient as well, you can click on that and that will then generate a letter here. So you can see here it's given the diagnosis that we explicitly said into the scribe, the actions for the GP, the actions for the patient, and the summary of our consultation today. So it can do lots and lots of things, including doing that scribe initial transcription, creating that note, and creating that downstream documentation. Now, the other thing that to really bear in mind is you've got this note here. What are you going to do with it? So if you actually want to go away and use this note and put it into your clinical system, all you need to do at that point is log into Accurx on any computer or desktop, click on Scribe again, and you will see all your notes that have actioned in real time coming through to that web platform. So you scribe on your phone, you do it on the go, complete the note and review it when you go back to your computer or your desktop. And that means you can do a ward round, maybe see 10, 12 patients in a row, and you can go back to your computer at the end of it and you can see all of those notes as they've been transcribed straight in there as well. So that's a really, really quick overview into how the app works, the new features that are in it, the scribe tool that we've got off it as well. And we're going to just touch on a few other points before we hand over into Q&A. So I'm going to stop sharing that for now and go straight back into our presentation. Okay, fantastic. Can everybody still see we're back on the presentation screen? Fantastic. All right. So just to touch on a few things before we dive into Q&A. The first section I want to cover off is clinical safety. Now, clinical safety is obviously of paramount importance. It's something that we always need to consider when we're using any new technology in clinical care. So a few things to know. How have we built clinical safety directly into Scribe? So as a user, you are always in the driver's seat, especially when you're using Scribe. You need to review and approve every note that's generated. Nothing gets saved or nothing gets sent without your absolute say-so in doing so. So that's something to always bear in mind. If you move too fast, for example, if you're copying a note before you've had a chance to read it, we'll make sure that we flag that to you and ask for you to review it as well. Because we've seen that there's certain cases where you look through the note, you really want to quickly move on into the next task. If you don't make any edits, if you don't make any changes, we'll just give you a quick reminder to say, are you sure you're happy with the content of this note before moving on? Now, it's also, explicitly designed to try and reduce as much error where possible. It filters out background noise, it avoids guessing what was said, and it doesn't try to suggest diagnoses or plans. But one thing we always emphasize is that AI isn't perfect. It can sometimes hallucinate, which means, making up some information that maybe wasn't said, or it could omit important details that were. That's why we're building Scribe with these inbuilt features of warnings and review points to help reduce this, but ultimately you're always in control. And finally, we're making sure that you've got reminders, prompts, onboarding tools to guide continued safe use. And Scribe is also DCB 0129 compliant. That means it has been developed with all clinical safety standards expected of any health IT system in the NHS. And those controls, as I said, are built into the product itself. A little bit on how you can use Scribe responsibly. Like, while the product has a lot of safety features built in, there are a few really simple things that you can do to use Scribe responsibly in practice. First, just let the patient know that you're using AI transcription. It's also, generally it's recommended that you get some form of consent from the patient that they're happy for you to use this tool. Doesn't need to be formal. You can say something like, I'm using an AI tool today that can help me take notes more easily. Do you mind if that's okay? That transparency really matters. And in most cases, patients are totally on board. Secondly, as I said, and we're going to carry on reiterating it, review everything. Even though it can produce really good summaries, it may not always be perfect. So make sure that you always review that note before you do anything with it. Always use it in the right context. Scribe is designed for patient care and clinical conversations, for conversations with or about patients. So make sure you're always using it in the right context. And finally, keep your judgment front and center. Scribe is there to save you time, not to think for you. So if something looks off, trust your gut and make those edits as necessary. Now, in terms of how you can actually, get going with starting to use it, what does your org need to do to help you support on that? So as with any new technology used in clinical settings, it is important to follow your trust governance processes before rolling out Scribe. That ensures things like, safe, responsible use that's aligned with your local policies. We're here to support you through that journey, whether that's providing documentation, answering governance questions, or working with any of the clinical safety teams that you've got at organizations. We've also made this easier by creating ready-to-go materials, whether that's a clinical safety case, whether that's a hazard log, or a DPA template. All of these have been written by clinicians and professionals for NHS use. But honestly, one of the best things you can do is just test it out, see how it works, show others what it could do, watch the videos that we've got that run through the demos, and see and actually try and feel how it can save you time in clinic or other clinical settings. And we're always here to help. So if you're not sure where to start, our clinical team and implementation teams here at Accurx are there to support you or your organization every step of the way. And finally, before I hand over to Deanna, I just want to talk a little bit about medical device or not a medical device. One of there's huge topical questions that's going around at the moment. So the big question we sometimes get asked is Scribe a medical device? And the answer is, it's complicated, but we're being very deliberate and transparent about it. It's an emerging area. Right now, ambient voice tools like Scribe are being used by staff across the NHS every single day. And the NHSE has recently published guidance that they've advised that AVTs or ambient voice technologies should be treated as medical devices. And so we've taken a cautious and proactive approach in supporting that. So Accurx Scribe, powered by Tandem, has got Tandem's Class 1 medical device certification already in place. And we're actively working towards Class 2A certification as the product evolves and takes on more clinical functionality in line with NHSE guidance. So yeah, obviously, if there's any further questions on that, do let us know. At that point, what I'm going to do is I'm going to hand over to Deanna to talk a little bit about how we're prioritizing privacy and security by design and default. Correct. I will do it myself.
Right. Okay. Hopefully everyone can hear me. Right. So hello, everyone. So I'm Deanna. I'm the privacy lead here at Accurx. So now we're going to go around, I'm going to talk a bit about what we've done to prioritize privacy and security by design and default into the mobile app. So as Vish mentioned at the beginning, and some of you might already know, when we acquired the app, it looked quite different. So this was not just in terms of the look and feel of the app, but also in terms of the security of the app and the privacy by design element of it. So we worked hard. And by we, I mean our product team, which is led by Jam, our product manager, who is on the call, just to make sure that privacy and security are a priority for the app before bringing in any of the exciting features that Vish presented earlier. So one of the security controls we've introduced is multi-factor authentication, or MFA, if logging in with your email and password or NHS single sign-on. So before I go into the details of why we've decided to do this, I would like to explain a bit what MFA is and does. So when you sign into your online account, regardless of the service, you will need to use your email and password. So this process is called authentication. And when you go through this process of authentication, you prove to the service, in this case, Accurx, that you are who you say you are. And traditionally, this was enough. However, with the advancement of technologies and all of the different threats going on out there, people's passwords are becoming easier and easier to be guessed by individuals that are not so well intended, which meant that there was a need to introduce an additional step as part of this authentication process, which we called verification. So after you sign in using your email address and password, you are asked to add in an additional code to further confirm that you are who you say you are. So when you add your email and password, you say, hey, this is I am who I say I am. But then through this multi-factor authentication, you further verify that you're actually the person that is trying to log in. So why we've introduced this? So one, because we want to address the risk of unauthorized access. So there's a lot of, patient sensitive confidential information within the app and the Accurx platform overall. So we want to make sure that only the people that's their account, they have access to it, but also because we want to, align and follow best NHS data security and protection standards. So if you go to the next slide. And in addition to that, because of the nature of a mobile app, we understand that it would be too much, right? So every time you go into the app, you'll have to input your email address, your password, your MFA code, and this will be quite a big, ask to do it every time you want to access the app, which is why we've introduced biometric security. So what biometric security will do is when we turn this on, you will be asked to set up a 6-digit PIN that you will use whenever you will access the app. You can also turn on biometrics, and you can set the biometrics as the default to access the app. And every time, after a period of 15 minutes of not being active within the app, you will need to re-input the PIN. I just want to mention specifically that, say, for example, if you're doing a consultation with Accurx Scribe and it's longer than 15 minutes, this is not considered as a period of being inactive. You will still constantly show as being active because the phone is recording to that consultation. So why we've implemented this, like I mentioned, because we want to further increase the security of the app, but also we want to address the risk of unauthorized access. So for example, if the device gets stolen and it was left unlocked, if they access the app because they won't have your biometrics or your 6-digit PIN, they won't be able to open the app. And I mean, Vish introduced and at the beginning, the new exciting features that we're putting into the app. But this also meant that the more features we add into the app and the more useful and valuable we make this tool for you, it also means that we add in more data and sensitive information, which is why we've also implemented technical controls that will block you from being able to take screenshots or screen recordings. And we've done this because we want to address the risk of patient data being stored on the local device. And we want to make sure that all communication that you have with and about a patient only takes place within the remits of the secure platform and the Accurx environment. And overall, this helps ensure that we address the risk of sensitive data being leaked. So everything is kept within, our infrastructure and within the security of our platform. And if we go to the next slide, so we also implemented technical controls on new directory entries. And being completely transparent, one of the concerns that we've heard even before acquiring the app was the fact that users were allowed to add new entries into the directory that maybe were not appropriate to be added. So either it being people's personal mobile numbers without their knowledge, or door codes to sensitive areas or rooms, which were not appropriate to be there. So we've implemented technical controls, which identifies when a new entry is being made and flags the following. I'm not sure if you'll be able to see, but the first screen there is when you want to add a new entry and you add a mobile number, we detect that's a mobile number. But we are aware that there's some legitimate use cases where mobile numbers are appropriate to be there because they might belong to a department. So we prompt users, will prompt you and will ask you to confirm that actually that's not someone's individual personal number. So you're aware of that. Additionally, in terms of door codes, which is the second screen on the slide, we outright just blocked having the ability to add door codes just because we want to address the risk of unauthorized use or access in those areas. And Vish alluded to earlier, but no data is stored on the device, and this includes the audio for Accurx Scribe. So all data is stored within our secure cloud infrastructure, so nothing will get saved on your phone, for example. And in terms of Accurx Scribe, the audio stream, so when I was doing the consultation with Vish, was being processed in real time, which means that when Vish clicked for the transcription to be generated, when the transcription was generated, the audio was getting automatically deleted. And that's because we want to make sure that we're not storing more data than is necessary for the tool to be used. And then in terms of the actual consultations themselves, they're only retained as personal data for a period of 30 days. And obviously, Vish covered the clinical safety governance of it, but I would like to touch on the fact that there are a lot of governance and compliance considerations when using Accurx Scribe, and it goes without saying that you will need to follow your organization's internal procurement processes. But we want to reassure you that Accurx has always held very high standards around patient privacy, and we continue to do so with Accurx Scribe or with any other future features that we might be developing. And that's why we've documented the relevant risks associated with Accurx Scribe in a detailed data protection impact assessment, which we're going to share with you after this webinar. And we've also updated our data processing agreement that reflects the use of Accurx Scribe. So that was a stop tour of that, and I think we're moving on to Q&A now.
Great, thank you so much, Diana. And that kind of rounds up our, me and Diana kind of talking at you about all the stuff that's going on. So we're really happy to move into a Q&A section now. I know people have been sending questions through into the chat. So I'm going to try and have a look into those as well to see if there's anything that we want to pick up during the on the call itself. So let's go into the Q&A. Okay. So what we'll do is I can see there's a few questions in here. And I know some of them have been actioned and spoken about. What other templates does it offer other than a doctor-patient consultation? Can we create our own template that would suit our own workflow? Yeah, really, really great question. So at the moment, what we've done is we've built templates alongside Tandem and kind of clinical colleagues that work in the NHS to have tailored templates to each individual specialty. So for example, if you're working in gastroenterology, for example, we've got one that's a gastroenterology ward round that's heavily weighted in terms of its model to focus on key gastroenterology terms, but also things like IBD reviews or liver cirrhosis or whatever it might be. Now, it is on our roadmap that we want a level of personalization for users as well, so that people can customize their own experience, and that will be coming soon as well. So yeah, really exciting in terms of the future of templates. Does it allow you to log into your phone? Yeah, can see that people have answered that. Yes, it does. You can log into the phone app simultaneously with the desktop app as well. Does the patient need to download Accurx for us to send messages? No, and I know someone's already got onto that as well. The Accurx app and the Accurx experience is for you to use. It's the staff-facing platform that allows you to communicate with patients. Patients, all they'll see is a normal SMS that comes to their phone, in which they can reply on by clicking on the link and submitting their date of birth to reply. It's actually something that many of you may have already used with your GP or local care services when you're having back and forth messaging conversations with your primary care team. This was there was a feature for non-public telephone numbers for GPs. This is gone now. So that's the GP directory I was talking about. Now, we don't have the non-public telephone numbers for every single GP practice, but ones that are kind of publicly available via the NHS, we've been able to put that into our directory. So that feature will be there within the GP directory as part of the app. let's see. Any other questions on here? I know there's probably some in the chat function as well. Let me see if there's any that we want to pick up specifically here. Yeah, I know some people have said here I don't have the message patient button. These are all kind of new features that are coming to the app. We just wanted to make sure that we made everyone aware of these features before we dropped it into your devices. Yes, let's see. Is that towards the bottom of the chat, Deanna? Great. Is it possible to transfer or share notes saved in Scribe with System 1? Yes, absolutely. We have got the ability to save notes back to the record with those EMRs we've integrated with. So that includes EMIS and System 1. With System 1, actually, you've got the ability to use a native desktop app for Accurx. It's a little toolbar that sits above your EPR. So once you use Scribe in that, you can save it back to System 1 as well. Does Scribe retain patient identifiable information within notes? And since clinicians often use personal devices, could this raise any data security or GDPR compliance concerns? So no, really good question. I might lean to Deanna for the second half of the question as well. At the moment, if you for example, if you say that you're speaking to Deanna as part of the consultation and you're writing a letter or writing a note, that can pull through. The name of the patient there can pull through. But the key thing to flag there is, the reason why we've added a lot of these extra security measures is to make it more difficult for people to try and get into that mobile application to access all that information. It gets deleted after 30 days. Deanna, is there anything else you want to share on that specific part?
Yeah, I just want to mention that I'm not sure if you might have posted this question sort of towards the end of my presentation, but you said that clinicians often use personal devices. We're aware of that. That's why no data gets stored on the local device. And this is applicable not just for the mobile app, but also if you're using desktop or web. So nothing gets stored within the local device itself. So everything still gets hosted within the Accurx infrastructures on our service. And in terms of data security and GDPR compliance concerns, obviously the same compliance and the same controls that we have put in place for our other parts of the product will apply for the mobile as well. However, it would also depend on your local context to discuss, with your ICB or with your trust in terms of, what's the policy for mobile devices, or what are some of the considerations that might be quite different based on your local context as well. And the third question was, does Accurx sync notes between its mobile app and desktop version? Yes, it does. And I'm not sure if you've noticed in the demo part that Vish was doing, at the end when the transcription and the clinical note was generated, there was a pop-up that said, move on to web. So you could carry out the consultation on web if you're a web user, or on desktop if you're a desktop user.
Absolutely. So what actually I'm going to do now, which might make it a bit easier to see how that actually looks. I can actually show you the screen of what it looks like in our web version. So if you just give me 1 second, I'm just going to make sure that we've got that set up. Great. Can everyone see that on my screen here with the Scribe setup? So if you go to web.accurx.com and you log in as you do in your mobile device with your Accurx account, email address and password, you can then actually go straight into that workspace in which you've created the Scribe from, click on Scribe, and you can see here on the left-hand side that you've got those encounters directly there. So that's the encounter that I did at 12:21, so roughly about 25 minutes ago, and that will populate live into the web version of Accurx. And yeah, as Deanna alluded to, we'll always prompt you to do that at the end of your Scribe. It comes up with that pop-up at the bottom that says you can access your notes via Accurx Web. You go to web.accurx.com, you click on Scribe, and you'll see those notes there. Great. Let's see if there's any other questions to pick up on. Yeah, I can see that Annabelle has touched on the Scribe Lite version and unlimited access. There you go. Deanna, is there any other questions you see here that we may not have got through?
So how the Accurx benefit admin team?
How does Accurx benefit the admin team? Yeah, no, really good question. And trying to build out a wider use case for admin staff is something that we're continuously working on. Now, if you think about the workflow, there's a lot of, you say you're an outpatient clinic and you create an outpatient letter, say you dictate it or you type it up, and then you end up doing that, and then you send it to your secretary to type up, then you send it back and it gets approved, and then you come back and you have to review any edits. There's a lot of back and forth. What we're trying to do here is actually reduce the overhead that comes with both the clinician and the admin staff. If the clinician can generate a letter and they're happy with it, they're happy with the content, and they send that straight on to their admin team to forward on, that in itself will reduce that overhead for admin staff. The other thing that we're also been working on is the ability to do it for things like MDTs or clinical meetings, to be able to capture the outputs from those meetings as well. But it's something that it's a use case that we're continuing to try and develop and find out more information about how Scribe can really unlock valuable time and effort for admin staff as well. So we'd love to hear where you think, after seeing from the demo today, where you think this could be really useful in those particular scenarios. So thanks for the question. Yeah, so as I said, we touched on that a little bit earlier. So we've got carefully created templates for many different types of interactions: doctor-patient, nurse-patient, clinical MDTs, procedure notes, operation notes, etc. We also are building the functionality for users to have a level of customization and personalization for templates in their workflows. We're working closely with Tandem to do that. So yeah, that will be coming as well to the app. Let's see if there's any other questions in here, making sure that we're not missing anything. I think Rebecca's asked, can you edit the transcription in other ways apart from voice? If so, is this just on your computer? Yes, you can. So if you want to edit it, you can go into each section of that particular note and manually type and change that if you want to. So there's two options to do it. Either you speak into the microphone and it does it for you, or you can go in and manually edit it yourself as well. So we have both those options to be able to edit the template, and you can also do that on your phone. Sometimes it's just, sometimes particularly when it comes to editing notes, sometimes it's just a bit easier to be able to do that on a bigger screen on a computer, hence why we wanted to make that handoff that takes you to that workstation quite simple and easy to do. But yeah, I hope that answers your question, Rebecca. Let's see. Okay. Let's see. Can you say more about Scribe Lite, please? I think Rebecca's just asked that question. Yeah, certainly. We can share information about what Scribe Lite looks like and what it is with people who've joined the call today as well. So we can share that information with you, so you've got that to hand. Okay. What I'm really going to quickly get up on my screen is, where are we? Is the wait list as well. So you've got the wait list here at the bottom right corner. There's you can actively join the wait list today to get access to Accurx Scribe and Accurx in the Accurx app as soon as possible. So make sure you just scan that QR code and join the wait list. You'll just fill in a very short form so we can know more about who you are and how we can help you. Anything else in the chat? Let's see. Maybe there's more on the Q&A as well. So I can see people have covered the Q&A off. Great. Fantastic. Let's see. I think we've covered all the questions in the chat. If there's anything that we haven't answered today, please do let us know and just send us a message, and we'll try and get that answer to you as soon as possible. Please do join the wait list. Please do sign up. We're really excited about releasing these features to everybody. We want to hear from you about how you're finding them, what you're using it for, whether there's things we can improve. We'd love to hear that feedback from you. It's an exciting new era of being able to use Accurx on mobile devices, and it's something that we're going to be continuously constantly developing. So any feedback that we get would be phenomenal. We'll be sharing a recording, as we said, of the presentation today and the webinar after we're done. And thank you all so much for your questions. It's really cool to see the level of engagement. We're really excited about it. And yeah, please do let us know if there's anything you want to hear from us. Oh, Jam, have you stuck your hand up, or is it a clap?
Sorry, there was a clap.
Amazing. All right. Lovely to meet you all, and take care. Have a good rest of the day.